You likely can't escape news stories about the COVID-19 coronavirus, which the World Health Organization (WHO) has labeled a pandemic. While you likely don't need to worry, it's good to be informed so you can help stop the spread of the virus. Since this is a new disease, you likely have lots of questions about it. Many of the common questions about coronavirus are answered here, though there is still a lot scientists don't know about this disease. Method 1: Basic disease information. What is a coronavirus? The expression coronavirus alludes to a huge group of infections that make individuals wiped out. A large portion of these infections cause the regular cold and are common. Less regular strains of coronavirus likewise cause Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS), which are not kidding varieties of the virus. 2. COVID-19 is another, uncommon kind of coronavirus that became obvious in late 2019. 3. The coronavirus we are as of now managing is new, implying that it hasn't been found in individuals previously. COVID-19 is a term for the respiratory condition that can be brought about by this new coronavirus, implying that it makes you experience issues relaxing. At times, it can cause pneumonia. 2. What are the side effects of COVID-19? A great many people who get COVID-19 have not many to no side effects. You may think you have a cold or this season's flu virus and be better in a couple of days. In any case, up to 1 of every 5 individuals who get coronavirus will turn out to be truly sick and may experience difficulty relaxing. Side effects to look for include 4. Fever. Hack. Brevity of breath. Trouble relaxing. Tip: if you have these side effects yet have not been in close contact with any individual who has COVID-19, you most likely simply have a cold or seasonal influenza. Be that as it may, it's as yet a smart thought to disconnect yourself until your side effects have passed. 3. On the off chance that you get COVID-19, would you say you are going to bite the dust? Not likely. In spite of the fact that COVID-19 is by all accounts more destructive than progressively basic illnesses, for example, this season's cold virus, the casualty rate has been assessed to be around 3.4% as of March 2020. Most cases are gentle, yet patients who are older or previously engaging an incessant malady or condition normally get hit the hardest. 5. Contrasted with SARS, serious intense respiratory disorder, another coronavirus, COVID-19 is all the more effectively transmissible, however not close to as lethal. 4. Would you be able to get COVID-19 from items sent to you? Not likely. Albeit a great deal is obscure about COVID-19, it doesn't give the idea that the infection can get by on dry surfaces, for example, paper, plastic, or cardboard. Any items transported to you ought to be sheltered to use without danger of getting the disease. 6. Regardless of whether somebody with COVID-19 had hacked or wheezed on items before delivery them, it is impossible that the infection would make due through the transportation procedure to contaminate someone else. 5. How might I battle the shame related with COVID-19? Help instruct everyone around you about the way that, despite the fact that it appeared from the outset that COVID-19 started in China, the infection itself doesn't target explicit races of individuals, nor are specific races bound to get it than others. Truth be told, nations over the world, including a large portion of Europe and the United States, have affirmed instances of COVID-19. It influences individuals of different populaces, and anybody can get it. 7. Chinese and Asian individuals who you meet are not any more liable to be tainted than somebody of some other race, except if they as of late came back from China or were around somebody who is debilitated. Tell individuals that the infection is spread individual to individual through close contact. Despite the fact that the infection began in China, you're not in danger of getting the illness in the event that you, for instance, go to a Chinese cafe or shop at a Chinese-claimed business. 6. Will the COVID-19 flare-up stop when the climate gets hotter? Numerous infections, for example, seasonal influenza, don't spread as quickly in spring and summer months. Notwithstanding, since COVID-19 is another infection, researchers don't yet have the foggiest idea what will happen once the climate gets hotter. While you can guess that the danger would scatter with hotter temperatures, nobody knows without a doubt if that will happen. 8. Many coronaviruses have been known to proceed in warm atmospheres. Regardless of whether the infection dissipates with hotter climate, there is likewise an opportunity it could return when the climate cools again in the fall and winter. Method 2. Treating COVID-19. 1. What would it be a good idea for me to do in the event that I believe I'm wiped out with COVID-19? Call your primary care physician on the off chance that you have fever, hack, and brevity of breath and have as of late came back from movement or come into contact with a tainted individual. Disclose to them you presume you may have COVID-19 and ask your PCP what to do. They will probably advise you to either remain at home and separate yourself or go to a disengaged clinical setting for testing. State General Wellbeing Labs and the CDC are dealing with all testing as of March 2020, and there could be an overabundance in your area. 9. Call ahead to your PCP or to a clinic and let them realize that you need to come in and you presume you have COVID-19. Giving them this admonition will permit them to make arrangements so you don't spread the sickness to other people on the off chance that you do have it. In the event that you have a health-related crisis, let crisis responders know when you consider them that you speculate you have COVID-19 so they can likewise play it safe. They will probably detach you in a negative weight room so it's more outlandish the infection will contaminate others. On the off chance that you are outside the United States, your National Wellbeing Office or the World Health Organization (WHO) will probably oversee testing in your general vicinity. 2. How is somebody determined to have COVID-19? In the United States, your state general well-being lab or the CDC will affirm a COVID-19 contamination. Outside the United States, your National Wellbeing Office or WHO will decide whether you are tainted. In the event that your primary care physician figures you may have COVID-19, they will take tests of liquid from your nose and mouth. That liquid will be sent to a state or national lab to test for COVID-19. They may likewise test liquid from your lungs, or test your pee or stool to decide whether you have some other infections. 10. In the event that you have pneumonia or trouble breathing, your primary care physician may arrange X-beams of your lungs. Symptomatic testing for COVID-19 is restricted. For instance, in the US, just state general well-being labs or the CDC can direct the best possible tests. Your primary care physician will probably assign you as an individual under scrutiny (PWI) and keep you disengaged until the test outcomes return. Since state labs are currently assisting with testing, results are accessible quicker than they were toward the beginning of the outbreak. 11. 3. Do you need to remain in the emergency clinic on the off chance that you have COVID-19? Not really. Increasingly serious cases require hospitalization. Be that as it may, the vast majority who contract COVID-19 can remain in their homes, as long as they self-segregate. Your primary care physician will inform you as to whether you can return home or in the event that you should be hospitalized. In any case, you should be isolated so you won't spread the virus. 12. Your state general well-being office will disclose to you when it's all right for you to leave isolate. They'll follow you all through your recuperation to ensure you're showing signs of improvement and aren't presenting others to the infection. You may need to go to the medical clinic on the off chance that you need a ventilator to enable you to relax. Medical clinics can likewise flexibly you with additional oxygen, which makes it simpler for you to inhale all alone. On the off chance that you feel more great remaining in the clinic than returning home, let your PCP know. For instance, you may be worried about spreading the sickness to your family on the off chance that you get back. Keep on observing your indications in case you're remaining at home. On the off chance that your indications become increasingly serious, call your primary care physician at the earliest opportunity. 4. What prescriptions are accessible for COVID-19? As of March 2020, there is no particular drug that is affirmed to treat COVID-19. Pharmaceutical organizations and research associations are leading preliminaries of antiviral medications to treat the illness. In any case, it is improbable that a medication will be accessible for human use before the finish of 2020. 13. A few associations are additionally taking a shot at building up a potential antibody for the illness. Nonetheless, it's not known when an antibody would be accessible to general society. You can assume control over the counter drugs to assuage your fever and different side effects of COVID-19. Simply remember that these drugs are just assuaging the side effects themselves, they are not treating the infection. Cautioning: monitor your side effects while assuming control over the counter medications and call your primary care physician in the event that they appear to deteriorate or in the event that they don't improve in spite of assuming control over the counter medications. 5. How might I shield from spreading COVID-19 to other people? In the event that your primary care physician has affirmed that you have COVID-19, or on the off chance that you are associated with having COVID-19, separate yourself from others. Remain at home aside from when you will get clinical consideration. At the point when you go to the specialist, consistently wear a face mask and abstain from utilizing open transportation, ride sharing, or cabs. While at home, take the accompanying precautions. 14. Remain in a different room from every other person and utilize a different restroom if conceivable. Fundamental careful covers help forestall the spread of the infection by preventing the wearer from presenting others to hacking or sniffling. On the off chance that you are debilitated, wear a careful veil when you are around others if possible. 15. Spread your mouth and nose with a tissue when you hack or sniffle. Promptly toss the tissue into a trash can and wash your hands. Try not to share family unit utensils, towels, bedding, or attire with different individuals from your family. Screen your side effects and call your primary care physician if your manifestations exacerbate. 6. How might you tell when COVID-19 has run its course? Regularly, manifestations will be generally gentle, so it very well may be hard to know without a doubt precisely when you're not, at this point, infectious. Your General Well-Being Division will screen you while you're in isolate and disclose to you when you're obvious to leave your home or the medical clinic. When your indications are away for in any event 24 hours, they'll test you to check whether you despite everything have the virus. 16. Try not to leave your isolate until the General Well-Being Office affirms that it's safe for you to do as such. They may save you in isolate for a few days after you're not, at this point suggestive in the event that something goes wrong. Method 3: Preventing COVID-19 infection. 1. How might I shield myself from COVID-19? The most ideal approach to shield yourself from COVID-19 is to abstain from being around individuals who are wiped out with the illness. In any case, if the individual is asymptomatic, you may have no chance to get of knowing whether they have the ailment until you've just gotten the infection. Different advances you can take to limit your introduction include: 17. Washing your hands for in any event 20 seconds with cleanser and water in the wake of heading off to the restroom, before eating, and in the wake of cleaning out your nose, hacking, or wheezing. Removing yourself from others and investing the greater part of your energy at home. Contacting your eyes, nose, and mouth as meager as could be expected under the circumstances. Remaining at home in the event that you are debilitated, regardless of whether you simply have a typical virus. Cleaning and sterilizing all surfaces that are often contacted in your family unit in any event once per day. Covering your hack or sniffle with a tissue and promptly tossing the tissue in the refuse. Be careful about dubious calls or messages identified with COVID-19 that are mentioning cash or data from you or requesting that you click a connection. There has been an expansion in these tricks as of late where hoodlums claim to be from the CDC. 18. 2. How might I help with endeavors to forestall the spread of COVID-19? The most significant thing you can do is remain at home. Rehearsing social removing when you must be out will likewise help ensure you and people around you. In case you're capable, it's likewise an extraordinary thought to give to associations that are managing the COVID-19 emergency. It's a perplexing, worldwide issue, and these associations need all the assist they can get. 3. What would it be advisable for me to do on the off chance that I can't stay away from somebody with COVID-19? In case you're thinking about a wiped out relative, you might not have the advantage of basically avoiding any individual who has the ailment. Wear expendable gloves and a respirator consistently when you're in a similar room as the individual who is sick. 19. Abstain from contacting the individual's organic liquids. On the off chance that you wash a wiped-out individual's dress, sheets, covers, or towels, wear expendable gloves and don't let them contact your attire or skin while they're filthy. Discard expendable gloves following utilizing them and wash your hands altogether. While wearing dispensable gloves, don't contact any piece of your body, particularly your face or your eyes. 20. Regardless of whether you are simply thinking about a wiped-out individual, you ought to make certain to self-detach for 14 days since you might have the option to convey and spread the infection regardless of whether you have no symptoms. 4. What's the distinction between a respirator and a careful veil? A careful cover, or face mask, is intended to shield the general condition from your respiratory issues. Interestingly, a respirator shields you from anything in the earth. A respirator is thicker and fits more firmly than the face masks you may be acquainted with, pervasive in China and other Asian countries. 5. Imagine a scenario where I come into contact with somebody who has COVID-19. On the off chance that you are in close contact with somebody who you know has COVID-19, call your primary care physician right away. They will probably encourage you to segregate yourself for 14 days. On the off chance that you don't get any indications inside that 14-day time span, your primary care physician will probably reason that you don't have the disease. 23. On the off chance that you've as of late been presented to COVID-19, any indicative test may return negative. Regularly, your primary care physician will educate you to hold up a couple with respect to days before coming in for testing, except if you are as of now demonstrating side effects. 6. To what extent would it be a good idea for me to disengage myself in case I'm presented to COVID-19? COVID-19 has a hatching period up to 14 days. For the most part, this implies in case you're presented to COVID-19, you could become ill from the infection as long as about 14 days after you were first uncovered. Isolate yourself and advise your primary care physician that you should be tried. From that point, the General Wellbeing Office will screen your advancement and disclose to you when it's sheltered to leave quarantine. 24. Regardless of whether you do become ill during that 14-day time frame, it may not really be identified with COVID-19. You could become ill as a result of something different. On the off chance that 14 days pass and you don't give any indications of disease, this by and large implies that you're no longer in danger of becoming ill from COVID-19 or giving the ailment to other people. Cautioning, it might be conceivable to spread COVID-19 even while you don't have side effects in the event that you've been tainted. Avoid potential risk to forestall the spread of COVID-19 on the off chance that you've been presented to the infection, regardless of whether you don't have any manifestations. 7. Would it be a good idea for me to wear a face mask out in the open to shield from getting COVID-19? Fabric covers or covers are suggested by the CDC for use openly places, for example, markets, open vehicle or whatever other region where you may come into contact with many individuals. Spare careful or other expendable veils for clinical experts except if you have been told to utilize them by a doctor. Wearing material covers may help keep transmission from individuals who convey the infection however have no manifestations. In the event that you are wearing a cover, you despite everything must wash your hands often and abstain from contacting your eyes, nose, or mouth with unwashed hands. 8. Would I be able to get COVID-19 from contacting a debased surface? It's conceivable, yet this isn't the primary way the infection spreads. Specialists trust COVID-19 spreads through beads from contaminated individuals. On the off chance that these beads choose a surface, you contact them, and afterward you contact your eyes, nose, or mouth, it's conceivable you will become ill. Be that as it may, it's not satisfactory to what extent the germs stay on surfaces, and it's far-fetched the infection makes due for long. 26. Clean and purify things around your home that are much of the time contacted by individuals, for example, TV remotes, telephones, and door handles, in any event once per day. On the off chance that somebody in your family is debilitated, disconnect them and don't impart family unit things to them. Clean their things independently from everybody else's. 9. Can pets get COVID-19? In uncommon cases, COVID-19 can be spread from people to creatures, yet there is no proof that creatures have a noteworthy influence in spreading the infection. On the off chance that you have COVID-19, you should let another person in your family unit deal with any pets while you are debilitated and keep them out of your room. Abstain from petting, cuddling, or imparting food to your pet. Continuously wash your hands when collaborating with your pets. Thank you for Know to How.